We were one of the first participants in the Beacon project for telemonitoring of diabetic patients, and we were able to quickly identify 25 patients that we thought would be ideal to benefit from the telemonitoring service, which, as you know, monitors blood sugar readings as well as weight, blood pressure, and pulse oximetry if that's necessary. We actually selected our most difficult patients for participation in the project and immediately saw some huge benefits for patients. We're able to identify whether patients, in fact, were following any type of diet. Some patients didn't have access to supplies. For example, we had a couple of very young diabetics that were not doing their testing because they couldn't afford the copays on their supplies. So the Beacon project, in conjunction with telemonitoring nurses and our staff here, were able to facilitate those testing supplies being supplied to the patient, as well as the education to use that. And that's a key piece to diabetic monitoring and management. And that was all funded and provided by the Beacon project. Since that time, we've had numerous patients who have demonstrated definite clinical improvement through the efforts of the telemonitoring project. The feedback on the telemonitoring program from the providers has been very positive because it allows them to have very accurate monitoring of what the patients are doing. For example, several patients freely admitted that when they came into the office and they had to turn in their blood sugar reports, that they would fudge them because they wanted their provider to be satisfied with them, although the provider would know from their blood work that they probably weren't accurate readings, but it was difficult, for the patients and for the provider to engage in that. The telemonitoring doesn't allow the patients to do that. They know that the provider's going to have their accurate readings, so it makes them accountable for actually doing the readings and for beginning to make the changes that they need to show their providers that they're fully participating in their care. It's been a really terrific program for the patients in terms of helping them to improve their outcomes, as well as providing a real direct link for the providers on follow-up for the patients.